My name is Sofia Geiger, and for my education infomercial, I chose the drug use of opioids. So, first of all, what is an opioid? An opioid is actually a class of drugs, so it's not just one drug. It can range from heroin, synthetic opioids, pain relievers, codeine, morphine, many other things fall in this umbrella term that is an opioid. When they are used correctly and following a healthcare provider's direction and instruction, prescription pain medicines are extremely helpful to those living in chronic pain, and they can even be life-changing. Unfortunately, misusing these prescription opioids risks altering your life in a completely negative way. Two of the most serious problems being becoming dependent or addicted to these medicines. So, some statistics for opioids: about 21 to 29% of patients prescribed opioids for chronic pain unfortunately end up misusing them. 8 to 12% of people end up with an opioid use disorder. About 4 to 6% of people who misuse these opioids end up somehow transitioning to heroin and misusing that. About 80% of people who use heroin first misused prescription opioids. So, trends over the decades, it's very clear that there's three distinct waves of the trends of opioids and the deaths that happened with those. So first we start in the 90s when doctors really started just increasing the prescription of opioids and really pushing it with patients. Now, there were a lot of overdose deaths and addiction that just completely is related to this increase in prescriptions. The second wave was about a decade ago, and a lot of these deaths were connected to heroin that was believed to be started with people misusing opioids. The third wave began in 2013 with significant increases in deaths that involved more of the synthetic opioids, something that you might remember hearing is fentanyl. So sometimes fentanyl is mixed in with the opioid, and that was what was, giving a lot of people a lot of trouble. So some risks of using prescription opioids. The two I'm going to focus on today is dependence and addiction. So dependence is when you feel withdrawal symptoms whenever you're not taking the drugs. And addiction, which is much stronger and worse and can have really dire consequences, is a chronic brain disease that causes a person to compulsively seek out these drugs, even though they're causing them harm. The risk of dependence and addictions are higher if you're misusing these medicines. Misuse includes in simple terms, taking the drug or the medicine not how the doctor instructed or prescribed you to take it. If you're doing anything other than what the doctor said, then you're misusing these medicines and you're at risk for becoming dependent or addicted. So some signs of addiction to keep an eye out for is taking the opioid in a way that's wasn't directed to you, just misinterpreting the doctor's directions. Taking an opioid even when you're not in pain, but just in case. You see mood swings and mood changes in people that are abusing these drugs, because they go from these huge mood swings of happiness and elation to hostility and anger, and it's very obvious. Changes in sleep patterns because these medicines disrupt your sleep cycle. Borrowing medicine, saying you lost it, going to different doctors to try and get more medicine, and poor decision making, things that are putting themselves and those around them in danger. Since I talked about the signs of addiction, I'm going to give a resource. So one that I found very helpful online was the Substance Abuse and Mental Health Services Administration. It has a national helpline at 1-800-662-HELP, and it's confidential, it's free, it's always available, it's offered in English and Spanish, and it's offered to both individuals facing mental health issues or substance use disorder, as well as the families around that. It also gives opportunities to look into local treatment facilities, community-based organization, and support groups. So if someone is having an overdose, these are some of the signs you can look for. The person's face is very pale or feels clammy to touch. The body goes limp. Their fingernails or lips have purple and blue color to them. Or they start vomiting or making noises that sound like they're going to be, if you can't awake them, or they're not able to verbally speak to you, or if their breathing or heartbeat is slowed or labored at all. Those are very obvious signs of an overdose. And if you are witnessing any of these signs, it is very important that you call 911 if any of these signs are observed, because overdoses very much can be fatal. And then here are some of the resources that I used for this presentation. So thank you so much for listening.